Go,
Right, begin.
Get the audience.
Get the audience,
Okay. Attorney Max Kennedy's blog from litigationandtrial.com asked the question, should bars and restaurants be held responsible for negligently serving alcohol to visibly intoxicated persons for the damages that they incur? The New Jersey Supreme Court says yes. As a server, it's important that we're aware of this responsibility when it comes to serving alcohol, that we simultaneously make sure our guests are enjoying themselves while preventing any alcohol-related incidences. In order to accomplish this, we need to be aware of the factors that lead to intoxication and the cues that we can look for to tell us that a person is crossing the line. Let's start by talking about the law. The law states that servers make a reasonable effort not to visibly serve intoxicated people and not to serve anyone under the age of 21. It is called the Dram Shop Act. When dealing with customers and intoxication laws, servers need to develop people skills that will let them be in control while giving good customer service. First, we should think about the image we want to project to our customers. They are here for an experience. They're here to have a good time or maybe just to get away from it all. We've all been there on the other side as a customer. So we need to create a comfortable atmosphere by delivering good service. We can create a good rapport with our customers by greeting them in a friendly manner with courtesy and respect. Not only will this increase your tip, but it will put them on your side if we need to intervene. Part of our duty is to encourage responsible drinking. Some customers are not familiar with the various liquors. Make suggestions about different products. This includes a cappuccino or an espresso. You don't have to always offer liquor. Now that we have discussed people skills in a social drinking setting, let's talk about how we can use these skills to assess our guests' level of intoxication. Blood alcohol content is the legal measurement of alcohol in a person's blood. In New Jersey, it is 0.08%. Alcohol does not require digestion, and therefore it is directly absorbed into the bloodstream. The more a person drinks, the higher their levels will be. Research shows that there are factors that can affect this rate of intoxication, and there are cues we can look for to help measure this index. According to the TIPS training manual, there are 6 factors that correspond with an individual's BAC. First, size and gender play a role in this. Smaller people will be affected sooner. But body fat also accounts for a faster BAC level because fat does not absorb alcohol. Therefore, larger does not always mean slower. Women, however, do tend to reach higher BAC levels quicker than men because they are smaller and have a higher percentage of body fat. Rate of consumption, strength of drink, drugs, drug use, and food are also other factors that affect the level of intoxication. A tolerance for alcohol has no effect on the BAC. So you should know that a straight-up drink has the fastest absorption time. If you add water, it will slow the rate. If you add soda, it will make the rate increase. 12 ounces of beer equals 5 ounces of wine, which equals 1 ounce of 100 proof liquor. Our drinks are pre-measured, and this is why. Be aware that medication can interact with alcohol, and food will delay the absorption rate, but time is the only thing that will lower the BAC. Now let's cover the cues that can help us identify someone that is approaching intoxication. Reduced inhibition is always the first sign. This will present itself if someone is overly talkative or overly happy, which can lead to poor judgment. This is the second cue. This will cause changes in personality, and someone with poor judgment may hassle you or your customers. We've all had that happen to us already, so you know what I'm talking about. But worst of all, they may think that they can drive. The third cue is the slowed reaction time. You can recognize this when someone forgets that they already ordered, has trouble opening their wallet, or has slurred speech and glassy eyes. The last cue is coordination. This is when the customer starts walking in a stagger, spills their drink, or falls off the chair. Another thing to look for is a strong odor on a person's breath, because a person with a high tolerance for alcohol that may not show the other signs will have this element. By going over some approaches to prevent intoxication, and and respond to situations when a customer has gone over the limit. You can utilize these steps. First, remember to make sure the person you are serving is 21. You can do this by checking for a valid driver's license. Look at the date of the birth, look at the expiration date, and look at the picture and the lamination. If you're unsure about the ID, ask security to check it for you. Warning signs that someone has a fake ID include nervousness, ordering for someone else in the crowd, or giving you an attitude when you ask for ID. If a patron does not have a valid proof of ID, don't serve them. If you're unsure, remember to call security. Once you have established the customer is of age, you should pay attention to how much the customers are drinking. Be aware that they may have already ordered from somewhere else before they came to you. Slow them down and cut them off if necessary. We can prevent the discomfort of flagging someone, though, if we follow these steps. Only refill drinks when a customer asks for one. Don't serve drinks that are too strong. Not only will this increase their levels, but it may make them sick. Time is the only friend that we have in lowering the BAC level. So space out their drinks, offer them coffee or non-alcoholic beverages or food. And don't be afraid to tell them you are slowing them down. Just do it in a nice way. In spite of all our efforts, we still may encounter someone who had too many. Cut them off. Politely but firmly tell them you are concerned about their safety. The law requires that we make a reasonable effort not to serve visibly intoxicated patrons. You could say, "Sorry, but I can't serve you any more alcohol, it's against the law." And then document any incidences. Inform the rest of the staff so they don't serve him if he tries to get a drink somewhere else, and inform security so they can make sure that he doesn't drive. Okay, we have gone over the people skills that will help create an enjoyable experience for our guests while controlling the situation and promoting sensible drinking. And we've gone over how alcohol affects our guests and the cues we can look for to identify someone who has too many. Last, we learned how to respond to our customers by preventing intoxication and handling a situation once it's occurred. Remember, we can help our guests have a good time while we look out for their safety and the welfare of the community. So let's use these skills in a positive way. Now go make some well-deserved tips, ladies. Thank you.
Thank you. Another A+. Well done. Well done.
Thank you.
Okay, you need to take out